Okay, good afternoon, everyone. We're just going to give everyone a few minutes to come in and then we'll get started. Okay, good afternoon, everyone. So thank you for attending today's webinar. Few things to remember: this webinar will be recorded. Your microphone and camera will be turned off for the duration of the webinar. And to assure accessibility, live captions will be enabled from the control panel. So my name is Carlene Stobie, and I am a Knowledge Translation Specialist with the National Collaborating Center for Methods and Tools, and I will be your facilitator today, and Alana Miller will be our support. We have a wonderful presentation for you today on an evidence-informed decision-making competence measure, which will be presented by Emily Belita. So before we begin, we have our land acknowledgement. So the NCCMT is hosted at McMaster University in Hamilton, Ontario, which is located on the traditional territories of the Mississauga and Haudenosaunee Nation and within the lands protected by Dish with One Spoon Wampum Agreement. So a few housekeeping things to bear in mind. If we do recommend you use a wired internet connection for the webinar today for best results. If possible, to use the latest version of Google Chrome or Firefox internet browser. If you do have any technical difficulties, please send a private message to Alana Miller, and we will respond to those requests. If you have any questions throughout the presentation, please send them to the Q&A and chat, and we will get to those at the end of the webinar. And lastly, we will have a few polls popping up throughout the webinar, so please make sure to answer those and submit them when you are ready. So after today, the slides and recording will be available in about 2 weeks' time. The recordings will be posted on our YouTube channel, and our slides will be posted on the SlideShare account. We will also send out a tweet, so keep an eye out for Twitter at NCCMT. So right now we have our first pre-webinar polling question. So just want to get to know a little bit more about who's attending today. So how many people are watching today's session with you? Have you visited the National Collaborating Center for Methods and Tools or used its resources before? And if you said yes to the previous question, how many times have you used the NCCMT's resources? So we'll give everyone a little bit of time to answer those questions. See just a few more answers trickling, so we'll just give it a minute or so more. Okay. So the National Collaborating Center for Methods and Tools is one of the 6 national collaborating centers across Canada. We are hosted at McMaster University in Hamilton, Ontario, and our goal is to support public health professionals and organizations integrate evidence-informed decision-making into their work. The National Collaborating Center is funded by Public Health Agency of Canada. We each focus on different priority public health topics. So from the west, there's the National Collaborating Center for Indigenous Health in Prince George, British Columbia, the National Collaborating Center for Environmental Health in Vancouver, British Columbia, the National Collaborating Center for Infectious Disease in Winnipeg, Manitoba, the National Collaborating Center for Health Public Policy in Montreal, Quebec, and lastly, the National Collaborating Center for Determinants of Health in Antigonish, Nova Scotia. So at the NCCMT, we have many products and services to support public health professionals in engaging in evidence-informed decision-making. This includes our registry of methods and tools with over 270 methods and tools. We have online learning opportunities, including our 13 online learning modules. We have workshops. We have Public Health Plus, which is a repository of public health research. Video series, including our Understanding Research Evidence videos, which go through concepts of important research in short and easy to understand ways, and also networking and outreach opportunities. So without further ado, we have our presenter today, Emily Belita, who works as an assistant professor in the School of Nursing at McMaster University. We are excited to hear all about Competence Measure, Emily. So with that, I will stop sharing my screen and you can go ahead and share yours.
Thanks so much, Carlene, for that introduction. And good afternoon, everyone. I'm so pleased to be here on behalf of our team to present to you on our new evidence-informed decision-making, or EIDM, competence measure. Thank you so much for taking the time out of your afternoon, or if you're in another time zone, morning or evening, to be with us for the next 40 minutes or so. So in addition to that introduction that Carlene mentioned, my background prior to my position as an assistant professor here at McMaster University was working as a public health nurse, as a frontline public health nurse in school health and chronic disease prevention. And the idea of this tool really stemmed from some of my clinical experience in terms of when I was working as a frontline public health nurse, wondering what was my role with respect to EIDM. I knew that it was in certain competencies and standards, but didn't quite understand specifically what I was expected to do. And so from that clinical frontline practice, that's really where this idea emerged from. So thank you, Carlene, for doing our land acknowledgement. And over the next 40 minutes or so, what I'll do is provide a brief background in terms of why we embarked on the development of this particular tool, get into some more detail in terms of our development process, and then share with you some screenshots of what the online tool looks like on the NCCMT website, and then briefly touch upon some practical uses in terms of frontline practice, but also research as well. So we know that EIDM is very important. It's well documented in terms of how EIDM contributes to improving client outcomes and also the implementation of cost-effective and effective public health interventions. However, despite us understanding the benefits of that, across the literature, implementation rates of EIDM have been documented as being low to moderate across healthcare professionals. One of the barriers that has been identified with respect to EIDM implementation is really related to the lack of EIDM assessment tools and the lack of clarity around competencies related to EIDM. So we have some national and provincial standards for public health professionals that somewhat address EIDM expectations at a broad or general level, but what they're really lacking is with respect to the specificity that can help public health professionals identify what exactly is their role in relation to EIDM. So this is a really great quote in terms of assessment. So if we are not able to measure EIDM competence, then there's really no opportunity for us to help with planning professional development or other capacity building strategies in order to help us improve EIDM skills, knowledge, and behaviors. So essentially, our EIDM competence measure is really meant to assess EIDM knowledge, skills, attitudes, beliefs, and behaviors in a broad way. So this is an opportunity for us to identify needs and strengths, both at the individual level and at the group level as well. In terms of how the tool is structured, it consists of 27 items that are self-report, and each item is rated on a 7-point scale. We have 4 subscales. The first subscale is EIDM knowledge that consists of 7 items. The second subscale consists of EIDM skills items, which there are 5. Our third subscale addresses EIDM attitudes, beliefs, and that consists of 5 items. And our EIDM behavior subscale consists of 10 self-report items. We used quite a rigorous process to develop this particular tool. We used a 3-stage process. In our first stage, we conducted a psychometric systematic review of existing EIDM tools across the literature so that we can have an understanding about the existing landscape and identify some of the limitations and some of the strengths of existing EIDM tools. We then went on to develop items based on the identified strengths and limitations of existing EIDM tools, and then went on to validate the content of these items. And our last stage consisted of psychometrically testing the tool. So we assessed validity, reliability, and the acceptability of the EIDM competence measure. When we embarked on the tool development process, we used many conceptual definitions to guide our work. So first, we defined EIDM as involving the identifying, sharing, and application of the best available evidence in public health practice. And then we went on to establish conceptual definitions for each of our EIDM competence attributes. So we defined EIDM knowledge as the understanding of theoretical and practical concepts and principles of EIDM. EIDM skills was defined as the application of EIDM knowledge to perform tasks related to EIDM in a practical setting. EIDM attitudes or beliefs were defined as the perceptions or personal beliefs about and the importance assigned to EIDM. And EIDM behaviors were defined as the enactment of EIDM steps in a real-life healthcare setting. With respect to how we went about our stage 1 of our psychometric systematic review, we looked at several online databases in addition to the gray literature. So looking at relevant nursing organization websites, conference proceedings. We also hand searched relevant journals such as Implementation Science, and we looked to those that we considered content experts with respect to EIDM assessment. So those that we identified within the literature as having experience in the tool development process in relation to EIDM, we contacted them to identify if they knew of any other existing tools that were currently in development but weren't published. In terms of how we selected the studies to be included in our systematic review, that was done independently in duplicate by 2 reviewers. And we extracted data looking at 2 categories. So we first wanted to look at the study or the measure characteristics. So we looked at if a particular tool assessed different EIDM competence attributes, so knowledge, skills, attitudes, beliefs, and behaviors. We looked at the context within which a tool was used, the population it was used in, and then we also extracted psychometric outcomes with respect to acceptability, which we defined as missing data or time to completion, reliability. We looked at inter-rater reliability, internal consistency, and validity evidence as well. So due to the heterogeneity of the evidence that we anticipated, we conducted only a narrative synthesis of psychometric outcomes and measure characteristics across practice settings. So what did we find in our systematic review? We included 103 studies in our review, and across these studies, we identified 35 unique EIDM measures. Interestingly, the majority of them were used or developed for acute care, and there were limited tools that were used in public health, primary care, and long-term care. So specific to public health, we only identified 4 tools. In terms of the assessment of attributes, the majority of tools only measured one attribute. So they either only measured skills or just attitudes, beliefs, or just behaviors, or just knowledge. There were 3 that we identified that measured all 4 EIDM competence attributes. When we looked at the psychometric properties of these tools, there was really a lot of limitations in terms of understanding acceptability. So how long did the tool take to complete, which we know is helpful for practical situations, and limitations in terms of the validity evidence that was reported as well. So primarily, reliability was reported among all of these tools with respect to internal consistency. So what I've done here is included a snapshot. So this table too is from our systematic review. And our systematic review can also be used as a resource for you in terms of selecting other types of EIDM assessment tools for your particular context. So we've created tables that list the specific EIDM assessment tool, the settings they're used in, the population. We looked specifically at those that were used among nurses, and which EIDM competence measure they have actually assessed. So I've linked our systematic review on the slide there for you if you'd like to take a look at that. We've also synthesized the psychometric properties. So if you're looking at using a particular tool and wondering about how strong their psychometric properties are, that's also synthesized within our systematic review as well. Moving on to stage 2, we developed items at this stage and looked to validate the content of our tool. So after identifying in our systematic review the 35 unique EIDM measures, we conducted a content coverage assessment. So we looked at all of the individual items across all of these 35 measures and identified if they covered all or one of the EIDM competence attributes, so knowledge, skills, attitudes, beliefs, and behaviors. And we also looked to see if they covered all 7 of the steps of the EIDM process. So once we identified some content gaps and strengths within these existing measures, what we found across these measures that there were a lot of limitations conceptually in terms of the knowledge and the skills items within these existing tools. So we decided to develop our own EIDM knowledge and skills items and combine that with items that were identified from 2 existing measures, the EBP belief scale and the EBP competency tool. So these 2 tools addressed the competence attributes of attitudes and beliefs and behaviors, and they were deemed to be psychometrically strong based on our systematic review. So we confirmed permission from Dr. Bernadette Melnick, who is from the United States, to use these existing items and combine them with our self-developed EIDM knowledge and skills items. And we also sought her permission to potentially modify them for a public health context because they were developed for an acute care context. So we integrated our EIDM knowledge and skills items and tools from these 2 existing and items from these 2 existing scales, and that generated 63 self-report items and organized according to subscales of knowledge, skills, attitudes, beliefs, and behaviors. With this set of 63 self-report items, we decided to assess the content validity of that. So we engaged an international panel of 11 EIDM and public health experts who rated each item on a 4-point scale according to their relevance. So whether they believed that item was very relevant or not at all relevant to each of the conceptual definitions of EIDM knowledge, skills, attitudes, beliefs, and behaviors. We then assessed the content validity, which ranged from 0.64 to 1.00 of each of the items, and deleted any items that fell below 0.78. So that resulted in us deleting 28 items. We modified 23, we added 5 and kept 12 in their original form. We then wanted to test this new set of indicators with public health nurses, so the end users of this particular tool. So we conducted cognitive interviews, individual interviews with 9 public health nurses across Ontario. And we assessed comprehension, ease, or difficulty of each of those particular indicators. So this resulted in us only modifying 8 items to improve clarity based on the feedback we received from these interviews with these public health nurses. Our next stage, once we validated the content and looked to address response process of our 63 self-report items, we then assessed validity, reliability, and acceptability. So this was a cross-sectional study, and our sample consisted of registered nurses in Ontario health units in any role or department. So they completed the self-report online tool that consisted of the 40 items in our proposed EIDM competence measure. And we assessed validity evidence, reliability, and acceptability of this as well. So this was tested across 16 Ontario health units with 201 registered nurses. And we looked at the item subscale correlations and reduced items from 40 down to 27. And that resulted in a 4-factor model. So this really confirmed our conceptual understanding of EIDM competence, consisting of 4 competence attributes of EIDM: knowledge, skills, attitudes, beliefs, and behaviors. And we also assessed validity evidence based on relationships by looking at relationships between the competence attributes and education, EIDM training, project involvement, and organizational culture. Our items, our subscales also confirmed strong internal reliability, strong internal consistency reliability, ranging from 0.8 to 0.96 for Cronbach's alphas. And we only had 7% of participants who had missing data on at least one item. And our total completion time averaged to about 7 minutes and 20 seconds. So fairly a short amount of time that would be needed in order to complete our tool. So our final 27-item EIDM competence measure resulted in 7 items that were related to knowledge and rated on a scale from 1 to 7, so from poor to excellent. We included 5 skills items rated on a scale from beginner to expert, 5 attitudes and beliefs items rated from strongly disagree to strongly agree, and 10 behavior items that were rated from 1 not competent to 7 competent. So we've transferred over the survey or the 27-item tool to the NCCM website, and this has already been launched. So the online EIDM competence measure is freely accessible once you create an online account with NCCMT. So once you get to the main page of NCCMT, in order to access the EIDM competence measure, what you'll do is you'll click on the training tab and click on the icon that says evidence-informed decision-making competence measure. And this will take you to the landing page. So it has an introduction to what the evidence-informed decision-making competence measure is, and an explanation that the purpose of this is really exploratory in nature and to help you identify broad needs and strengths. So one of the primary questions that I received when we were testing this measure was, Emily, what is the difference between the EIDM competence measure and the learning needs assessment? So first, the EIDM competence measure is self-report, as I mentioned, and obviously meant just to be a starting point in terms of identifying broadly what your areas of development and strengths are, while the learning needs assessment is more objective in nature. It consists of multiple choice questions And it relates to more of identifying very specific knowledge and skills that you will need for EIDM. So in terms of how this can be used, as I mentioned, you can use this on an individual level for professional development, or you can use it in a team environment if your team would like to, if your manager or supervisor is interested in understanding from an aggregate level what the specific needs are for a particular team in terms of each of the competence attributes. This tool can be used in a team-oriented way as well. So once you launch the EIDM competence measure, this will take you to a screen that looks like this, where across the top, you'll see the different tabs. So we have a tab for each of the subscales. So this one identifies the EIDM knowledge subscale. It tells you how many questions is in it in this particular subscale. And I've just screenshotted for you the first 3 items or questions in the knowledge subscale. So knowledge of what is involved in the define step of EIDM, and you would just click your rating, knowledge of what's involved in the search step, and knowledge of what is involved in the appraise step of EIDM. And these are the 7 items that we've included under the knowledge subscale. So you'll note that 1 item each covers each of the process steps of EIDM. If you were to click on the next tab, the EIDM skills tab, which consists of 5 questions, this is how your screen would appear. So I've screenshotted the first 3 EIDM skills items. So ability to develop an answerable practice question, and you would rate yourself from beginning to expert, ability to use online databases that house research evidence, and ability to use critical appraisal tools to appraise the quality of research evidence. And I've listed the 5 EIDM skills items to the right for you. And moving on to the EIDM attitudes and beliefs. So this consists of 5 items. And examples of this: I believe that I can implement EIDM in a time-efficient way. I believe I can engage others in implementing strategies to address barriers when implementing EIDM. And I've included the rest of the EIDM attitudes and beliefs items to the right of the screen for you. And then lastly, our EIDM behaviors items. So some examples: I question public health practice for the purpose of improving the quality of care or service delivery. I describe public health practice issues using client assessment data, such as in relation to community, individuals, families, or populations. And I've listed the EIDM behaviors items there for you as well. So once you click submit, after completing all of the subscales, what you'll receive on an individual level is an executive summary. So you'll receive your average scores for the subscales on the left and your average scores for each of the items that relate to each of the steps of EIDM. And additionally, you'll be able to receive raw scores for each of the items belonging to each of the subscales. So this tells you your mean score and then all of the raw scores in addition to that. So again, you can just click onto the tabs at the very top to go back and forth between each of the subscales. And again, raw scores will be available for you in terms of individual items and mean scores across the EIDM areas. So this will be these tabs you can click on, and this again will show you the mean score and again the raw scores for each of the items that might fall or correspond to each of the different steps of the EIDM process. So in terms of practice and use, as I mentioned before, this EIDM competence measure can be used to guide professional development and practice. So it can be used for you in terms of a self-reflective component, or be used by your team supervisor or manager if your team would like to have an understanding across all of your individual members in terms of where your strengths or your limitations lie. And then you can plan for capacity building or professional development opportunities to address either specific steps or either just knowledge or specific behaviors. When I embarked on the tool development process, one of the things I thought about was integrating some of these indicators into annual performance appraisal. So as a public health nurse, I had to engage in these performance appraisals every year, and I always wondered if there was opportunity to integrate some EIDM specific ones into my performance appraisal so that I had an opportunity to reflect on how I'm doing in terms of meeting these expectations and if there's opportunity for growth as well. And there is also potential to use this in research as well. So to gauge the effectiveness of EIDM capacity building interventions and to understand the impact, particularly on specific competence attributes of knowledge, skills, attitudes, beliefs, and behaviors as well. So we are considering future areas of research in terms of use of this tool and looking at potentially a multi-method approach to EIDM competence assessment. So is there opportunity to compare the validity of our tool, the EIDM competence measure, with a learning needs assessment as well? Also, this tool has only been tested across a sample of public health nurses. So that's why we've launched it to the NCCMT website, with the hope that others from other disciplines will engage with this tool so that we can collect further psychometric data and understand its psychometric properties across different disciplines. And also, we hope to use this in either educational practice or in further intervention research as well, and try to understand its usefulness and psychometric properties within these contexts as well. So in summary, based on our rigorous development process, the new EIDM competence measure has demonstrated strengths in terms of 4 sources of validity evidence, internal consistency, reliability, and acceptability as well. So as I mentioned, there was low completion time and low missing data as well. And also it can be used for public health nursing practice in terms of organizational planning, personal self-reflection, and professional development. And we are looking to expand understanding of psychometric properties in nursing education and intervention research as well. I would like to acknowledge the rest of our team, Dr. Maureen Dobbins, Dr. Catherine Fisher, Dr. Rebecca Ganan, Dr. Janet Squires, and Dr. Jennifer Yost as well. And also acknowledge those public health nurses and public health and EIDM experts that contributed to the development of the EIDM competence measure. And with that, I'm happy to take questions now.
Thanks so much, Emily. That was a really great presentation. It was really great to hear the development of this tool and how it's really helped people make evidence-informed decisions. I've used it myself, and it's been really simple and easy to use. So thank you very much for your presentation. If anyone has any questions, please feel free to post them in the Q&A or chat box. I think there was one here. So Emily, has this tool been tested by public health professionals who are not nurses? Thank you.
Yes, thanks so much for your question. I believe I answered that at the end. So that's something that we're looking to for a future area of research. So it only has been tested among public health nurses in Ontario. And with the launch on the NCCM website, our hope is that, as I mentioned, that others from other disciplines will complete the EIDM assessment tool so that we can conduct further testing of it.
Great. So I think that's the only question. Let me take a quick check. We have another one here. Are we able to use EIDM to knowledge translation in practice? Yeah, are we able to use EIDM to knowledge translation in practice? That's the question.
Is the question, are we able to use the EIDM tool for knowledge translation in practice?
Yes.
Okay, yes. Yeah. So we do have, particularly in the implement, thank you for your question, particularly in the, with respect to implementation, we do have some questions that, or some indicators or items that relate to knowledge translation, since that is very much embedded in the implementation stage of EIDM. And most of those you can find within the behaviors, the EIDM behavior subscale.
Perfect. Thanks so much, Emily. We have another question that came through. Can we tailor this EIDM competence assessment tool for low-income settings like in sub-Saharan Africa?
Thank you so much for your question. So given the process of us going through quite a rigorous psychometric process in developing this tool, one of the things I've learned is that just because there are psychometric properties have been established within a particular setting or context doesn't mean that that can carry over into other settings as well. So I think that that's important to be able to test the tool in a sample from different settings, such as low income settings as well, or different countries. And certainly I've had others who have reached out from other countries ask to test the tool within their particular setting and also translate it as well. So if that's something that you're interested in terms of testing it with your particular setting, or you'd like to translate it, please do connect with me. And that's certainly something that we can discuss. And I'm happy to share the full scale with you as well, so that testing can also occur as well.
Perfect. Yeah, we have another question here as well. What members and expertise make up the team in validating assessment tool? Can I find more details documented about this validity process?
Sorry.
Want me to read it again?
Yes, please. Sorry.
Of course. So they're asking about the validity. So what members and expertise make up the team in validating assessment tool? Can I find more details documented about this validity process?
Yes, so I have linked, the slides will be shared, and I've linked, we have 3 publications corresponding to each of the stages of our tool development process. So in the second publication that I have linked, that relates to our content validity and response process. So in terms of the expert members, we engaged an 11 person panel. So that consisted of international experts who had expertise in EIDM and public health. And they were the ones that conducted the relevance ratings for each of the items. So that was who we engaged in to validate the content of the tool. And then we also validated the tool based on response process. And that was the process I mentioned where we tested it with the critical end users who were public health nurses in Ontario.
Amazing. We do have another question as well about the limitations. So what are the limitations for this research and what are your next steps?
So in terms of the limitations, as I mentioned before, this has only been tested in a very small sample size of a very specific population of public health nurses in Ontario, so in one province. And we understand that there are others from other disciplines who likely will have an interest in the use of this particular tool. So that's certainly a limitation, that we used a very specific population to test it. So there's further testing also that needs to be done in terms of potentially confirmatory factor analysis to add to the validity evidence and engage a larger sample and an interdisciplinary or multidisciplinary sample as well.
Perfect. So I think that's all the questions we have. I'll do a final call for questions. If anyone has any more they'd like to ask. Otherwise, we'll kind of wrap up to the final slides. Oh, don't see anything coming in. So I'm going to share my screen. Okay, perfect. Thank you so much, Emily, once again. Just to sort of wrap up, we would love to hear from the audience. So if you're using EIDM in your practice, or if you need any support with any EIDM, we would love to hear from you. So you can email us at nccmt@mcmaster.ca. And we just have a webinar feedback poll here. Everything is kept completely anonymous, and we would love to improve our webinars going forward. So if everyone could please indicate their answer to the following questions. Give everyone a few minutes here. You should see 3 questions on your screen, so you can scroll down to answer them all. I'll give everyone about 1 more minute. We have a few more answers trickling in. Okay. And then 1 more question. Are we able to contact you in the future to discuss how the NCCMT can improve its webinar series? Okay. Before we continue, there's actually 1 more question that's popped in there, Emily, if you don't mind. Answering quickly, it says, do you think this tool can be used by public health funders?
Thanks for your question. Just to clarify, so do you mean by those who are funding public health projects that they can use it themselves for assessing theirs?
Yes.
Yes, absolutely. Certainly, I think there's an opportunity to use it across different levels. So whether that be at the frontline public health level, at the administrative level, and also at the funding level as well. Certainly, we would have to do some testing to see if it's relevant or pertinent based on that particular population. But I think that there is certainly a strong foundation or a basis for its use with different levels within public health.
Thanks so much, Emily. And lastly, a few more things. So we have a lot of additional webinars with the NCCMT. So you can find any more webinars on a variety of topics on this link here. And we want to thank everyone for attending today. This has been such a lovely presentation where we've learned a lot about the tool and a really great discussion. If anyone wants any further information, you can reach us at our website, www.nccmt.ca, or you could contact us at nccmt@mcmaster.ca.
Thank you so much, everyone. Take care, everyone.
Thanks again, everyone.